Hello and welcome to the new Fringe podcast. I'm sort of cheating with this one. This is our first ever episode, so for the first ever guest, I actually know this person quite well. So yeah, cheating in the sense of this isn't going to be relatively too hard. But we have a cracking guest in Dr. Sophia Rafferty, and she's going to be exploring what it's like to be a modern vet. Some of the ideas you may not be too familiar with. So you're going to get a real great insight into what it's actually like to be a vet in the modern world. Enjoy. I get this show going. Then we're in A&E and I'm drinking hot chocolate, and it's one of those typical nights where I'm like, this is not gonna work in my favour.
You'd be mad, didn't you?
But we're finally here. I'm feeling a bit more happier and a bit more.
You've got your podcast voice on.
Yeah. My take it down like a few levels and then it's ready. But yeah, we got a coffee. We're going. The big pressure now is to actually do something with this. Like that's my big fear now. I've got to get the right people on. I've got
Not me.
No, you are the right person. No, because somewhere out there's people out there with all the cars. There's people with actual voices, what isn't one-dimensional. And obviously, I'm getting a guest on later what's to do the Doncaster documentary, and I've been looking at the voices on there, and it's a great documentary, but I still think it's just showing one side of Doncaster. So I think hopefully with this I can attract all the correct people what are going to actually talk in a way what will open the area. Because as I was talking in the car last night, it's sort of like a myth that you can't succeed in Doncaster. But I think we should segue into you, shouldn't we?
Do you think so?
Yeah. Take it back.
What will we say?
Well, at the very beginning of your life, you wanted to be a vet.
Yeah.
Because you see it on TV.
Well, it wasn't really because of that, actually. It was just because I was obsessed with dogs, and I was quite good at science. So everyone said, "Oh, are you going to be a vet?"
Well, so, what age is this?
I don't know, like 12.
So 12, you're obsessed with dogs. 12, somebody tells you want to be a vet.
Yeah. So just roll with it.
But then did you make sure that you would set your life up in a way where you'd have to get the grades to then go higher? So then from that day onwards, you got to make sure you're sort of on it.
It came pretty easy to me anyway, to be honest. I didn't actually try that hard. GCSEs anyway. A-levels was a bit harder, but GCSEs was alright. But I always took my education seriously anyway.
But was there any time where you're studying and you're thinking you don't want to be a vet? Or is it from 12 you wanted to be a vet?
Yeah, that was it then.
So there's no side?
No, even when I was applying to university, everyone was like, "Oh, why don't you have a backup option, put on like biology or something?" And I couldn't be more disgusted with that suggestion.
But what was you doing with biology?
Well, what would you have done? I don't know. I didn't want to be working in a lab or anything like that. Like, can I swear on this podcast?
Yeah, but not too many.
Oh, right.
Because if it's going on YouTube, there's like the censorship thing.
Well, I guess I can be quite stubborn. So when I decided that I was going to be a vet, that was it. I wasn't going to do anything else. Even though I did see some red flags on it.
What's the red flag?
Well, for example, when I did some work experience when I was, I don't know, 14, 15, something like that. I actually didn't like it.
But what's the work experience to do with?
I was just shadowing a vet in just a normal like small animal cat and dog clinic. Did some consultations, did some surgery, but it was the consultations that I didn't really enjoy, and I don't enjoy them now because it was just like.
But what is a consultation, just so people know?
Well, if your pet's sick, obviously you book an appointment. That's the consultation, but it's.
So you want the more hands-on side?
I don't know. It's just, obviously a lot of people as well, because I think a lot of other vets have fallen into this trap as well. You go into it because you really like animals, But most people that are really into animals like that actually don't like people. So that applies to me.
So
I don't want to talk to people every day. 15 minutes. Well, actually, back in the day it was 10 minutes. Usually consultations are 15 minutes now because, you know, the vets have been fighting back against the amount of stress it puts on them, because you can't do a good consultation in 10 minutes. You can't even do it in 15 minutes, to be honest with you. But 10 minutes. Every 10 minutes a different person for hours on end. And you've got to just, like, you know,
to be honest,
get them out the door.
You shouldn't have to deal with it. I think it's one of those jobs where it's a professional job. It's like when you go see a doctor, you don't try and, you know, talk about your day to the doctor. You're going in to get a very certain thing. So I think it should be polite, but I think in that sort of line of work, I think it should be very professional, and you treat the dog and then you move on. Because it's obviously a high stress thing.
Well, it is like that, but even that is just I don't like talking to people.
But is that the fear?
I don't want to talk to people all day. That's not me.
But do you think that's because you've got that fear that when people come in now, they've already Googled what's wrong with their dog? So
there is that.
So that they're sort of, even though you've studied and this is your world, people quickly Googled and they've read so and so, and now they're going to come in. Yeah,
because that's the thing these days. People's expectations are so high. You physically can't know everything. There was this awful woman, previous job that I had, that came in with her dog, and it was, you know, really sick, and we were doing all these tests trying to find out what was wrong with it, and it was like a fancy breed of dog or whatever. And then you know, it had been in the hospital a couple of days. You know, we were waiting for some results to come back. We were treating the symptoms in the meantime, and she comes in with this printout from Google. The breeder, you know, told her that one of the other pups had this condition, and it was a really rare condition no one ever heard of, that only happens in this breed, and even in that breed the, you know, incidence is really low.
Is it all true?
And then she's trying to, and then she's, you know, she's criticising us. She wants a refund. Why didn't we know about this? Why didn't we diagnose it immediately? We've never heard of it. I don't know every single disease in the whole world.
But has she got any medical experience, or she just researched?
She's just Dr. Google, isn't it?
Yeah, that's the thing though, isn't it? You could Google and you could find out anything, and you guys wouldn't know anyway.
You know, I've had people come to me. I've been treating their pet, you know, with a perfectly good treatment plan, and they'll go on Google, right, and they'll type in the pet's condition, and they'll click on a website, and they'll print it off, and they'll give it to me, and they'll say, oh, you know, this might be helpful for you. Fuck you. Really?
That's the first F-bomb.
I mean, I know they're only worried about their cat or whatever,
so you mean
but
they turn up with handouts?
Yeah, it's so disrespectful. I mean, you know, whatever.
But when you first started the job, was there any sign this was going to happen? Because you were telling me when you first started, wanting to become a vet. What's the name of that show you liked? Is it All Creatures?
Well, it wasn't really the show, it was the books, James Herriot. But I already wanted to be a vet before I was reading it.
Well, what's the title of the book?
All Creatures Great and Small.
So there's that sort of like fantasy. Now, did that never exist, or did it used to exist?
That used to exist back in the day, but those books were written in the 1920s.
So what is the life of an old vet? Like an old school vet? Old
school, yeah. It was, you know, they were just part of the community. A couple of hours in the morning, people would come in with the concerns. You know, you'd give them something and off they go. But you're kind of friends with them as well, and you'd chat in. And sometimes it wouldn't be that busy, sometimes it'd be crazy. And then they used to go out around the countryside and go to farms and just simple things, because back then people didn't have as much knowledge as they do now on how to treat like simple you know, illnesses and infections and stuff like that at home. But farmers especially do a lot themselves now, but they used to go out and just treat some stuff. Obviously they had to do all hours of the night as well, but it was kind of like more like a family and a community, and everyone was friends, and everyone for the most part respected them, respected their opinion. I mean, there's always going to be somebody that thinks they know better. Even in James Herriot's day, there was that he's written about like this random guy that goes around the farms selling.
Is James Herriot just like an author? Is he actually a vet?
Well, that's the pen name, but the author was actually a vet. Right. This is true. All the stories in there are true. I mean, they might be exaggerated a little bit.
Is it like a big book series, or is it just like...
Yeah, there's like, I think it's 7 books.
But would that still be taught today? Or people still looking at that today and then still becoming vets off of the back of like that sort of fantasy?
I don't think anyone thinks it's still like that, but I don't know. I guess it captures something like the innocent side of it,
which
is
helping
people,
appealing to a younger girl who likes dogs.
Well, yeah.
All right, so you study till what age do you finish, like studying before you start?
23.
23.
Yeah.
So you study all your life basically.
Yeah.
So from 12, you've got to be sort of on it.
Yeah.
Making sure you're getting all the top grades.
Yeah.
Till 23, really.
Yeah.
Damn. Yeah, I was not.
And then you realise that you don't like it.
no, but this is what I was talking about yesterday. Like when I got average GCSEs, so like C, I don't know if you do C minus. No, C. They did C minuses. I think it might do. Like you got your C minuses. You got like a merit. I think merit's highest I got. When I got those grades, I was made to feel like the only thing I could do now was do a bricklaying job. And I told you this, I went to, I don't want to name the company, but I went to do this bricklaying, and it's just raining and the guys have been really hard on me, and I just did not want to do that with my life. And then it sounds like on the reverse, you're sort of excelled to make it feel like because you've got these top grades, you're going to go to the top. But it doesn't also work on that side either. So it's almost like both sides of like failing, making you feel like you're just average, to then also being made to feel like you're a star in the academic sense. There's almost no...
Yeah, which is interesting because even me and my friend, who's also a vet, were talking about this recently, that actually with our kind of personalities and, what interests us, we actually would have preferred to be a veterinary nurse, because, we like to care for them, look after them, make sure their needs are met. We kind of prioritise that.
But why can't you do that as a vet?
You can as well, but obviously if you're a nurse, that's your focus, just making sure that animals are as comfortable as it can be, being the advocate for the patient in terms of pain relief, or making sure the vet's not missing anything. It's just a different kind of mindset, I guess, but it never even occurred to me whatsoever, to go into that, because obviously everyone was like, oh well, you got top grades, so you would obviously be a vet.
Was there any influence from your friends around you, what were trying to pull you in different directions, or was it just all in your own head, like this is what you want to do?
I think people would have thought, like, if I chose to be a nurse instead, that it's because I was like scared of failure or whatever. I
was sort of screwed from day one because all my friends were going to go do bricklaying. So when I didn't go do that, I was just like stood by myself like, right, what do I actually do now? And when I went to go study public services and politics and sports science, I had to make a whole new group of friends. So I felt completely out of place again. So I just think in any education, it's like the first day when I go to college when I met Peter.
Young Peter behind the scenes.
You're not terrified, but you've got to sort of change your whole energy to meet a new group of people, because you're thinking, okay, I'm meeting like the film lot. What are they going to be like? And you sort of change your whole life. It's how I was talking to you about. I think vets have a very, very... I'm just comparing stuff you and your friends. You all try and live in a very certain bracket. Like, remember when you kept ordering those food boxes?
Oh, yeah.
It just felt like a very like vet thing to do. There's some sort of like lifestyle thing what comes with every single job.
Well, there is a class thing to it as well.
Yeah.
But
this is the thing. I would never imagine like a vet to be actually like a a high class, even though I think it would be.
It's like a middle class sort of thing. So, which isn't really me, to be honest. You know, my culture, I would say, is working class. Even though my parents actually did have, enough money, like middle class amount of money. They both grew up.
Well, they've had to work.
Really working class, and that's their culture. So I feel that's my culture as well. So I never really got on with a lot of vets. I remember the first day actually in vet school, I moved into my apartment, and I looked out the window, and then there was all these kids, not kids, the fellow students on the balcony, and they were all talking, and I was thinking, bloody hell, these girls are so posh. They were all there with Jack Wills
with
and
like a
hoodie
over the shoulder,
whatever on, they look like horse girls and stuff like that. And I came into the kitchen and I said to one of my new friends, "Oh God, there's so many middle class people here." And he was like, "I'm middle class. What are you talking about?"
But what did you?
He seemed normal to me, quote unquote normal.
What did you look like at that time?
What did I look like?
Like what? Compared to these guys?
I don't know. Probably what I look like. No.
So quite nice. It's not too bad.
Just wearing random. I was wearing that Weezer t-shirt actually on my first day.
Well, that's all right.
And a skirt from the charity shop.
No, because
some Doc Martens.
Well,
pretty much looks exactly like this.
But was there any when you start speaking to these people, do you have to sort of put on a bit of an act?
Yeah. Well, when I started uni, first couple of years, I ended up changing my voice a little bit to sound more
pronouncing things a little better.
Which I've lost that now, which is fine because I don't really.
But do those people going to the workforce? I'm trying to work out: are these people? Will they still be the same now if you see them? Like, will they still be that? I've just got this idea that some people are just on a trajectory, and that at 12 they want to be a vet, then at 23 they still want to be it, and at 30 they still want to be a vet, and they're still following a scheme. Yeah,
there are a lot of people like that, but more and more people are choosing to leave because, it's not that great. It's not a great career. So
what are the main problems?
The main problems, these corporates coming in and buying up all the practices, making them into basically money-making machines for the big bosses, paying the staff as little as possible, overworking them, stupid hours, putting targets on people like, you've got to sell this many flea treatments, or you've got to make this much money, you've got to do this many blood tests. Do you know what I mean? And how can you be sitting there and getting told off that you haven't done enough blood tests? You're just going to do what the patient needs and what the owner can afford. So I don't know what they expect people to do. If someone's not got insurance, you can't force people to do something because you need to meet your target, which is totally unethical as well. It's disgusting that they would even put that on you. It's just...
I don't say you can measure...
Disgusting.
You can't really measure that sort of work, can you?
But they would try to. It's like, even in this job now, it started off not doing that, but now I've got to bring in at least 4 times my salary.
Wow.
Every month.
So that's sort of like...
What if it's a quiet month?
That's sort of like
that's not my fault.
That's basically saying to you, prove your worth 4 times, basically.
Yeah, and it's just... And, I don't even... If I hit the target, that 4 times is the minimum. Ideally they want at least 6 times, and if you earn 6 times your salary, what do you get? 3% pay rise. Oh, brilliant. 50 quid a month, if that.
Really? So this is the sort of the same when I used to work in an office. Anything I would do, so say if I saved a client, or if I did some really good graphic design, did this amazing marketing campaign, and it made, let's say, 15 grand, I would see nothing off of that.
Yeah, it's just nothing. Taking the piss, really.
But people don't understand that if there was to share that money around, it would make me want to stay there more and make me want to work harder.
I know, it's just so stupid. Like, all these companies out here, like, oh, why can't we keep vets? Why is there a recruitment problem? And then you do stuff like that, and you just pay people as little as possible. You're not flexible at all. No sick pay. Let's talk about that. Bloody hell. Like, how did I study? Did I go to university for 5 years, to do a really stressful job, to not get sick pay?
It's just in the vet world.
Yeah, it's disgusting.
So why are you guys being screwed on that?
I don't know, because they can get away with it, because there's these really big businesses and they don't care about the employees whatsoever. They just want to make money.
But you're still a frontline worker, the same as the NHS, really, aren't you?
Yeah.
And don't they get...
I don't know. Well, I think they get quite a lot of benefits, especially if they stay there a long time. Obviously, it's pretty hard for them too. They're also understaffed and everything like that, but...
But is there a reason why this has happened? Has there been like a thing what's changed?
Yeah, because in the last 10 years, when I started studying, majority of practices, I would have said, were privately owned by 2 or 3 vets, clubbed together some money and run a business, which obviously wasn't perfect either, but there was a lot more freedom in terms of accommodating for individual employees, and when they could run the business how they preferred. They could put their ethos into it. They could really make it their own. But now it's just it's everything. 90% now has been bought out by huge companies.
Even family businesses.
They've all been bought out.
But is it attractive for a family business to be bought out?
Yeah, they get a big payout.
But what happens to the people who own it then? Do they become middle management?
They just retire.
So they basically get bought out, they retire, and they don't care.
Yeah.
So that's sort of saying that.
And the next generation's absolutely.
And you're
screwed.
saying 90% of places sell out.
Yeah.
So that's almost saying 90% of places don't care.
Yeah.
And there's only 10% what
so
maybe do.
So you'll get the job, they'll work you to the bone until you get fed up and quit, and then you'll find a new job, and it won't really be any better. But because it's new, it's something a bit different. You do it for a year or 2, and then you move on again.
But do people still want to be a vet, or do they just hate the landscape?
Yeah, I think people actually want to be a vet. They want to treat animals, and they want to do the problem solving, and they enjoy actually being a vet, but they don't enjoy the workplace.
But has it always been like this since you first started? Because it's almost like then you've had 5 years of not actually.
My first job wasn't too bad. It was actually an independent, privately owned business with 2 vets that ran it. It was a good place to work, to be honest with you, and it did feel a lot more like a family.
Have you guys got any sort of union or anything like that? Is there any protection?
It's just recently become a union. So yeah, I think that's going to be the next step really for the profession. I think I don't know if I'm going to get involved because I'm pretty much done. I'm getting out as soon as I can. I can't bother with it anymore. But I think the new generation coming through need to kind of actually put their foot down and say, you're taking the piss here.
But why can't you guys do that?
Well,
because you're too exhausted.
Yeah, I'm exhausted. I'm burnt out.
But do you think it's because you're too annoyed, and if you were to step back?
I'm absolutely furious, to be honest with you, because I was sold a lie. I was told, get good grades, do this, do that, and you'll be comfortable. But
you've been sold a lie about a lifestyle, but you haven't been sold a lie about being a vet now, have you? You sort of enjoy, apart from the stress of the job, which comes at that sort of high pressure job, it's more the landscape you're working on which is the downfall.
Yeah, I guess. Yeah, actually treating the animals is actually all right. Quite like that.
Would there be any a system where I don't know how many vets it would take, 15 vets got together and actually bought out a place and kept it away from
but the thing is as well that another component of it is that these corporate practices can buy everything in bulk. They can get deals from suppliers of medicines and stuff like that. Vaccinations, everything.
So they got the key basically.
They can undercut people, and they've got more money for advertisements. You can turn on the TV and see an advertisement for a corporate
What sort of
vet
business
brand.
are we talking about? We're actually buying things out.
Well, the place I'm working for now is owned by Mars, the
the
chocolate company. Like, what's that got to do with being a vet?
Yeah,
They just bought it to make money out of us. It's absolutely disgusting. And then it has knock-on effects. Like, for example, you know, stray cats. Every practice will get stray cats. Where I'm working right now, we get quite a few, probably at least one a week. And obviously, your staff care about animals. That's why they're in the job. So they want to help the stray cat, treat it if it's got a problem, help to rehome it. But these stingy, bloody, they don't care. They don't give a shit about the stray cat.
Do you ever see these people, or they're just like completely like?
It's just the culture, like, so it's passed down from the big boss to their boss to the manager to the whatever to my manager. So then if I give this cat antibiotics, my manager's on my ass saying, oh, do you know how much this is costing? It's the cat's life. How can you put a price on that? Yeah. Peter's showing a picture of a stray cat which I gave him that I got from work.
Well, you want to tell that story, because I think there's a silver lining of like still being a decent person and being a decent vet and still going above your duty of care, no matter what's sort of happening to you. Like at the end of the day,
but then you end up just screwing yourself.
Well, no, because you messaged me saying, would you know anybody who would take a stray cat in?
Yeah.
And I said, I'll ask. And we asked Peter.
Yeah.
And I was very surprised Peter said yes. So I think on that sort of system, I'm not saying we completely change the whole system of how we do things, but I genuinely do think people would, because you would take in 16, 17 animals if you could.
Oh, yeah.
That's what I mean. I think there's a lot of
people. You're the only thing stopping me why I haven't got about 10 dogs already.
Well, so that's what I mean. So I think there'll be people out there like that. I think it's just reaching those people. Because I messaged 5 people, and it was Peter who finally got back to me. Like, I got like 3 maybes or 2. I don't know what I'd do with it. And Peter finally said, okay, I'll take the cat. And then the cat came to ours. I got a little bit attached to it. It was under the bed. We gave it a saucer of milk. We took it in the car. It tried to scratch me. It was a bit of an adventure. But that's you. Yeah. You're not getting paid for it. And you're not... I mean, we took a day out. And I remember that day it was quite stressful for us. Yeah. I remember we was both out of it and tired. We've both been working on things. And that's still you going above your duty of care. And from all the vets I've met, they're still... I imagine they'll do the same sort of thing. So I think...
Yeah, but I think the problem is, though, like... people like me who have a high level of empathy can't hack it because
Well, is that just the world now? Is that just how it is now? I mean, everything
can't hack the world.
Everything's Starbucks now, isn't it? Like, think of all the corner cafes, what no longer exists because Starbucks is.
I'm gonna start crying in a minute. It's so depressing.
No, it is, but that's what I'm saying. But don't you think your duty of care to actually do something like attach your cat to Peter is really important?
Yeah, but then if all the people like me leave the profession and then it's just people in there that are just fine to put cats down.
But does that exist?
Or just, yeah.
So there are vets
perfectly healthy cats. They just can't, even though physically it doesn't cost money for the cat to be in the kennel, give it a few sachets of Felix, you know what I mean, for a few days, nothing absolutely wrong with it. They'll make up like, the big bosses say every day that this kennel is used costs the business £100, so we can't afford it, so this cat's going to have to be put down. Absolutely disgusting behaviour. That's
crazy.
How can you call yourself a vet?
Wouldn't you get investigated now?
Oh,
can't
no,
you?
Because who knows about it? Nobody.
That's just basically like murder, isn't it?
Yes. It's disgusting.
Have you seen this yourself?
Yes.
And there's nothing you can do. Like, you can't go... Would people listen?
Well, if I'm there, I'll stop it, But, I can be looking after a cat for 3 days, and then the next day I'm off, and whatever vet's in charge thinks, this cat's old, no one's going to want to adopt it.
There's got to be like a law now, isn't there? What's going to come down on... Because that's basically... What do you call it when it's false practice?
Well, because the law with animals right now is that they're your property. So you know, if you put down someone's pet without their permission, it's like, it would be like as if you broke their phone or something legally. But if the cat doesn't even have an owner, it's just nothing.
If I go into a touchy area here, please stop me, but do you think the vets what are doing this look down on all the vets what aren't and maybe think they're a bit weak? Like they think...
Yeah, they'll be like, oh, you know, some people are too soft, or, you know, they need to be more realistic.
Would this be the job what would actually attract psychopaths?
Maybe, I don't know. Well, I think a lot of the vets that actually stay in it and the ones that get to the high levels, there is something wrong with them. Like, obviously, I told you a lot about my previous boss, who is an absolute narcissistic piece of dirt. You know, that's the kind of person that you've got running these businesses. You know, and for example, he would actually treat a stray cat and he would go above and beyond because he wanted to feel like he was a good person. But he'd only do it if it was like, if the cat needed a surgery that he personally wanted to do.
Yeah.
You know what I mean? So it was, in the end, it's all about him still, and he'd use it for publicity and stuff like that, and say to people, oh, I'm such a good person.
Wait, when you say publicity, what do you mean?
Like put on Facebook and stuff.
Really?
Like, oh, I'm so generous, you know, we've done the £4,000 surgery on this cat.
So it's basically he's using that as a marketing tool, really.
Yeah.
But the animals he's treating, is he actually doing a good, like, is it a hard job he's doing?
It is actually, to be fair. It's quite difficult, you know, procedure to do or whatever, so... But
then all the rest sort of get thrown under the bus.
Yeah.
That's crazy. Yeah, I'm starting to understand now why you want to come out
the profession, yeah.
But is it you want to come fully out, or you still want to work with animals now, don't you?
Yeah, I do. I would consider being a vet, but self-employed, you know, go around in my little van, vaccinating...
The locum, is that called?
No, well, you can be a locum, which is when you're self-employed, but you just come in and do shifts for other practices. But you get lumped with all the rubbish, like 12-hour days of consultations or dentistry. Everyone hates that. So, and I hate it too, so I'm not doing that. And also they've changed the law, so you can't actually really be self-employed with it now. You have to go through an agency who take a lot of your money. So I'm not really into that, but I'll be like fully self-employed, like my own business, and just have my own clients and go around doing simple procedures, you know, skin conditions or boosters and stuff like that, even euthanasia at home, but then obviously transfer to another clinic for out of hours care. But yeah, obviously, like I've told you already, I just want to work with dogs really rather than people, so I'm going to go into like training, behaviour, boarding, that sort of thing.
What, like is this something was felt by all vets? Do you think all vets, because you've just like applied for a new job, and you said there's not many like vets are in demand right now. Why is that?
Everyone's leaving because of this.
But what are they going to go do?
I don't know. A lot of people...
Didn't you tell me a vet stopped being a vet and became a postman or something like that?
Yeah. He said it was because of his eczema, but I think he just didn't like it as well. He's also got bad eczema. But yeah, he ended up... He was just so desperate to get out as soon as possible.
For sort of these reasons?
Left. I don't really know. I haven't spoken to him in a few years. Like I said, when I spoke to him, he said it was just because of his eczema, but I don't know if I 100% believe that. So he just had to get out, and he just took whatever job. You know, he ended up going around selling ultrasound machines to vet practices. But I don't know what he's doing now.
Just slightly change the what's just coming to my head now.
Right.
Remember yesterday when I was having that conversation with the two people on the boat, and the guy was saying like, oh, I could probably become a vet. And he might be able to.
Right.
He might actually be able to. But do you think it's still this perception that people still don't know what actually being a vet is now? Like in his head, he's thinking, oh yeah, I could probably become a vet. And it's probably going to be like what I imagined it is on TV.
Maybe.
Because a lot of people, like you told me as well, that people still are studying to become a vet. It's still in demand, isn't it?
Yeah. So the universities are flooded with applications, new universities cropping up everywhere, and partly the reason for that is that we're trying to like put a plaster over the problem by, instead of working on retaining vets, you're just spending bloody thousands and thousands of pounds training new vets who are probably going to do it for about 5 or 10 years and then leave.
So do you think as soon as they stop studying, they'll realise the truth, and then they'll want out of it as well? Because
even where I'm working now, there's 2 new graduates, so I've been working with them closely over the past year. Obviously it's been COVID, so it's not really a great year to start, but I can see it in their eyes. They're already disheartened, like they're broken inside. They've only been doing it for 1 year.
Fucking hell. Is there any silver lining?
It's funny because you sit at work and you'll have a day where you're fed up, and you turn around to your colleague and say, do you like being a vet? And they'll be like, no, not really. What about you? And I'll be like, no. You'll go around the room, hey, Anne, do you like being a vet? No.
How many vets are there compared to nurses in the practice?
Between like equal and like maybe 1.5 to 2 nurses per vet.
So like, would there be like 5 vets and then 15 nurses, or is it just like you said, even like one
It depends, because vet nurses are also in demand, because a lot of people leave that profession as well.
Is a vet nurse a hybrid?
What do you mean?
Well, there's a nurse, isn't there? Or is a veterinary nurse the nurse?
Yeah, that's the nurse.
Okay. I'm with you.
Yeah, well, the problem with vet nurses is that
I thought you meant like a vet nurse, like a nurse who's also a vet.
Seriously underpaid. It's actually a joke.
Well, what are you talking about now? If you just give me like an hourly rate,
like £8.
So that's minimum wage, a little above.
Like you could earn more working in Aldi, and it's an incredibly skilled and difficult job. Is
this where they groom and everything from, or is that different as well?
Not really grooming. Obviously, if a patient's in hospital and it's soil itself, whatever, they'll give it a bath.
That's what I mean. I don't mean grooming like
so they'll do stuff like that. Feeding it, walking it. Also giving medications,
would they know your job?
Putting IV lines in. Yeah, a lot of nurses who've been in the job
by like shadowing you.
About 20 years, they could turn around and probably do the same job as a vet. They can even perform minor surgery and stuff like that.
Really?
But they just get so much shit piled on them, and again with these narcissistic bosses, a lot of nurses get treated like shit. You get things thrown at them, surgical instruments thrown at them.
Really? Like
they get patronised. Just the other day, a new vet started at my workplace, and she was doing a procedure, and the nurse said to her, "This dog's painful." And she got laughed out of the room. People make them cry because they're trying to stick up for the animal, but the vet's ego is so big that they can't even listen to them, because maybe that's the class thing coming in as well again. Because a lot of these vets, they're right up their own arse as well, and a lot of nurses are from a working class background, and they do look down on them, which obviously is absolutely disgusting. But that's a problem as well. But yeah, a lot of nurses do leave, mostly because they're underpaid.
Is there any system in place where they can actually become a vet, or is it just
they have to just go to university and do the whole 5 years,
which is hard to do when you try.
Which a couple of people have done over the years, but it's a big effort. And obviously, you'd get paid more when you came out the other end, but it probably wouldn't be worth it. It's not that much more. Do you know what I mean? Like, compared to the stress. Like, if you really wanted to get paid more, do something else.
Which job would you say is harder, the veterinary nurse or the vet?
I think a vet, just because
you get thrown under the bus.
You've just got that added stress, like, because if the nurse feels out of her depth, and his or her depth, and they're freaking out or whatever, at the end of the day they can shove it back on the vet, and it's the vet's ultimate responsibility if something goes wrong with the patient. The vet's the one that's got to live with it. Obviously, it can be difficult if you're a nurse and you're working with a vet who doesn't have a lot of empathy for the patient and they're not listening to you, then they can feel that back on them. But like legally and in terms of the owner coming at you, it tends to fall on the vet. You know, like we get a lot of complaints, and usually people complain because they don't want to pay the full bill. You know, they're happy with the treatment that's been provided. You told them how much it was going to cost, but they're like, oh, let me see if I can get a discount on this. So they come in and ruin your day, disrespect you, you know, say that you're stupid, threaten to like basically blackmail you by plastering you all over Facebook. And I've had friends, vets, whose name has been plastered all over Facebook saying they're a bad vet and such and such. You know, because they want to get some money off.
But is it like a subtle thing, or are they actually coming in and like swearing?
Oh yeah, absolutely.
But
abuse.
Where do they get that confidence from to do that?
I don't know. Some people are just mental.
But
I've had people shout and scream in my face. You know, I've had this woman came in with a bloody I'm getting so angry. She came in with her cat and she thought she knew what was wrong with it. I examined the cat and that wasn't the case. So she went away and she was sitting at home thinking, no, I'm definitely right. So she came back in and asked to see another vet a few hours later. And she came in with this note and said, oh, I wouldn't have had to come back for another visit if that vet, in quotation marks, hadn't made a mistake. What gives you the right? Yeah. Quote unquote vet, like you know more than me. I was right.
So what?
She doesn't have the right to.
What happened in that situation? Is it one of those things where the bosses are so?
No, because then she saw one of the other vets, and the other vet couldn't be bothered to deal with her BS, so they just went ahead and did the procedure. Anyway, even though it wasn't necessary, which then makes it look like I wasn't actually right when I was. Yeah.
But does this come down hard on you?
Well, obviously it makes me feel like shit. I saw that and I started crying.
Apart from that, would like up above bully you in this situation? Do you have any support above where the boss?
Yeah, no, because well, it depends on your boss, but with that particular boss was that guy that I was talking about. That's not very nice. So whenever a complaint would come in, he'd come and talk to me about it, but it would be in a patronising kind of misogynistic kind of way, kind of, you know, talking sweetly but like undertones of you're not good enough and you need to do better, rather than actually supporting me. And as well, even with my current job now, my manager is actually a really nice person and you know, she's really nice to work with, but when people come in and complain because they want to get money off, you know, just to make her life easy, she gives them the money off, but that makes me look like I've done something wrong, but I haven't.
That's fucked up.
Yeah. Fun times.
But would all the staff at least be in agreement? Like, do you all get together in the staff room and you can talk about
bitch about it? Yeah.
Well, that's one thing. I think that's the most. I think if you didn't have that, you wouldn't get through hard times.
That's true.
Every staff, when I worked in the office, and it was the most horrific work environment I've ever worked in. It was the guy next to me who was just normal, like, you know, there's the guy across me talking about doing cocaine every night, sleeping with hookers, and I just felt so uncomfortable. And the guy next to me, when you look to your right and you see he also feels uncomfortable because he's like in a traditional relationship, and then the cocaine guy is bullying this guy, then you start, you know, feeling this guy's middle management, by the way. You can sort of form like a little clique together, and you can, like, we would bring each other coffee, and like, even though it might be the vet and nurse thing, we're doing completely different jobs. He was like selling some sort of like teaching software, and obviously I was doing graphic designs, but he would help me if I was getting screwed by middle management, and then I would help him if he was getting screwed by middle management. So at least in these environments, I think, because you've made some good friends out of it. So
that's true.
I know it's not sort of on, but, you know, I think if you can all sort of come together, I mean, if you're working in a place and you've got no friends, everybody agrees with the boss.
Oh, fuck that.
You're screwed, really, aren't you?
Yeah.
There's something I was going to ask you, but I forgot what it was.
Can I go to the toilet and come back?
Yeah. Talk to myself. I could do a promo now. I could do the promo for the. How long have we been going? 45 minutes. All right, so we'll wrap it up soon. Right, I'll do a promo. It can be like Sherry's Berries. Our sponsor, Bailey's Eco. It should be boutique, but shop works fine because this is the plaque for the shop. And I probably should wait for her to come back, and just because I don't know what's in these products, even though usually when I sell them at a market, I sort of lie to people. they'll be like, okay, what's in these products, and I'll just be like, oh dear. Sort of like all come out on the table. Can you smell that from over there? It smells nice now. It's like cocoa powder. Yeah, we have. I don't know if there's actually talk about getting sponsors for the show, but since we're sort of unpaid interns right now, I thought it would be cool to use my own business as the sponsor. What time are we on? All right, we're wrapping like 15. I've tried to keep it afloat, but I've ended up.
What have we done?
Spilling this on the thing.
What's that?
Do you want to sell a few of your products?
I suppose so.
Just talk about them.
Yeah.
I can be like your guinea pig or you. I spilled this on the table. I don't know what it smells nice, but I don't know what it is.
Thank you. So this is dry shampoo.
And how?
Chocolate and orange.
And what's in it?
Cocoa powder, cinnamon, orange essential oil. I can't actually remember. I think
Is it
there's
supposed
baking soda in there.
Is it supposed to be this powdery?
Yeah, it's a powder.
I can't remember. Let me just like.
So you rub it into your roots.
Should I gap there? I don't think I've seen this one before. I was just telling Peter
No,
that.
I haven't actually sold this one. This was a bit of an experiment. You just rub it into roots and it absorbs the oil. But it's still in progress.
Well, you rub it as the powder, or do you water it down?
No, you rub the powder into your... You know, have you ever used dry shampoo?
Yeah.
Yeah.
I don't remember being this dry.
Excuse me.
Alright, what else have we got? What's this?
That is body scrub.
Body scrub.
Winter spice.
What do you want to do?
Give it a sniff.
Oh, I thought you meant put your finger in it. It's more like that's more of a strong.
It's got vanilla essence in it, so it's got like a tinge of like alcohol smell.
I think this is for a very mature adult. This one.
Oh right.
And what's this one again?
Body scrub. So you use it in the shower.
This is such a shameless plug. It's so
exfoliate your skin.
We'll just say one more time. What's this one called again?
Winter spice body scrub. Exfoliate and moisturize.
About this one, this little
body butter.
Like honey jar.
Yep. Got no label on, so it's a surprise flavour. Orange and mint. Have a bit of that then.
Podcast number 1's going to be so strange. We've got this 15-minute segment where we're going to sell these things, and we've got Sophia
going absolutely mental.
Yeah. And taking a very unprofessional bathroom break.
Well,
you could have waited 15 minutes.
I need to pee.
So do I.
Alright.
This wasn't really smell of anything.
Excuse me.
What's it supposed to smell of?
Orange and mint. Put some in your hand.
Pass that to Peter. Hold that. That doesn't smell of anything, does it? Really? I can't smell anything on that.
I'll put it on you.
What do I do?
Body butter, innit? Moisturiser.
But where? Like on my...
Wherever you want. Where's dry?
Okay. It's a bit. It's very like. It's like a bit rough and then a bit like.
Oh.
That's like really sticky. It's not like dissolving.
You're meant to be promoting this.
Yeah, I know, but I've got to do it like authenticity, or people are going to think it's.
Well, I'm actually working on a new formulation. I say working. I've been thinking about working on a new formulation where it's basically because it's like pure shea butter and stuff.
I like it. It's just a bit thick.
Dilute it with water. I bought an emulsifier, so it's going to be diluted with water.
What's an emulsifier?
So when you mix the oily substances with the water, it doesn't separate, and it'll become like a cream, rather than.
That's like look at my hands now. Look how sticky they are.
Slimy boy, aren't you?
Yeah. Right, I know what these are, but you can explain them better. The hair oil.
Hair oil, bit of moisturisation. The blend of essential oils is meant to encourage hair growth.
We can now.
Hence my super long hair.
We can now put at the start of the podcast includes paid promotion. Then we can all look really chuffed at the very beginning.
Do you think so?
I can smell that's quite strong, isn't it? Which was the product? What that woman opened it was like, ooh,
that.
Is that one? Ooh, it's very strong, that isn't it?
I mean, it is very strong, but
that's just equivalent of something. Oh, that's interesting. Right, we can talk about your gift wrapping. Are you still doing gift wrapping?
Yeah.
You know like a promotion's supposed to last 2 minutes. About
Get
what?
a lip balm out.
Which one's that one?
Little ones.
Like these?
Yeah.
I don't know if anything.
What's in that?
I think it might be toothpaste.
Deodorant.
So I use that.
Minty fresh.
You put it like under your arms.
Mm.
Alright, I'll do that now. Whoa, it's very, very tough. All your products are very tough.
Excuse me. I meant to use a utensil to break a little bit off.
So you got to get like a little toffee hammer.
A toffee hammer?
A toffee hammer, and just chisel away at it.
It's a cold day, alright?
No, right, the eco-friendly stuff.
Yeah.
Do you think it's actually going to take over? Do you think it's just still like a practicality issue with it? Because everywhere we've asked about the deodorant, they've always been a bit weirded out by it.
To be honest with you, I'm a bit disillusioned with that too.
I'm really going to do this on here. I'll turn my back to the camera.
Because people just want convenience.
The buttons are popping. That's what I mean. So you can't. I don't know how you guys are going to compete against.
Even if you sell somebody this.
It's so shameless looking into the camera. Like
lip balm.
It's quite refreshing. I admit that.
Aluminium thing, right? This is fully recyclable. But are they just going to toss it in the bin though? And then that's.
Of course. Defeat the project. No, but to be fair,
what's the point of getting up in landfill?
To be fair, the demographic you've got, which is like the York demographic and Leeds, those people that actually do it properly.
Yeah, but
it's just a mass generation will have to get on board. This is very refreshing on the armpits.
2 months, I tried to give up plastic 100%, and I was losing my mind because it's extremely inconvenient. You can't. A lot of vegetables you can't get it without plastic.
Yeah, I remember you'd go to the shop and you would you'd try and not do the no plastic thing.
Exactly.
But everything it was like veg wrapped in
and
plastic.
then also you want to eat less meat, for the environment. But can you get a veggie burger that's not in plastic packaging? No. Can you get tofu that's in a recyclable package? No.
Do you think it's become like a marketing gimmick now? Because
even like the oat milk or whatever Tetra Pak, I don't think that's recycled where we live. So that's going in landfill. So I might as well buy cow's milk in a plastic bottle. But then is that going to get recycled? Does anything get recycled? When people start talking about all these straws in the ocean, I was like, well, that's not my fault because I always put my straws in the recycling. But then I realised that only 9% of the plastic that you put in the recycling actually gets recycled.
Really?
Yeah.
Is that for
most of it gets shipped off to countries like Malaysia, which is basically being used as a garbage tip for all the first world countries.
Really?
And a lot of it spilling into the ocean as well.
But how's that deal work? How do we get their plastic across the deal there?
I don't know. I guess we're paying them to take our plastic.
That's crazy.
Because I don't know, we can't be asked to recycle it.
Well, no, that's definitely we think we're above. So we.
It's absolutely disgusting.
Humans
are disgusting.
It's like keep the poor down.
That's the take home message. Humans suck. Choose dogs.
We'll end it there. That's it. I don't think we can top that.
Do you not think so?
No. Right.